XY ready. XY ready. XY ready.
You are rotating at the gynecology clinic for a week. In the clinic, you find the nurse preparing instruments A and B for a patient. What are these instruments called and what are they used for? Why is instrument B longer in the middle? A. Speculum, Cusco, used for widening the vaginal walls to allow visualization and examination of the cervix. B. Cervical brush, used for collecting cytological samples from the cervix during pap smear. Instrument B is longer in the middle to allow it to reach the endocervix. The shape of the brush matches the cervical contour. After insertion of the speculum, you observe that the cervix is bleeding and the surface around the canal is rough. Give 4 causes of pervaginal bleeding in general. The nurse proceeds to take a pap smear. What stain is used for this cytological preparation? Causes of pervaginal bleeding: uterine fibroids, cervical cancer, endometrial hyperplasia, endometriosis, miscarriage, sexual abuse. Stain used for pap smear: Papa Nicolau stain. Abnormal cells are observed in cytology and a follow-up cervical biopsy is therefore requested. The observation on histology is as shown below. What CIN stage is this? What surgical procedure may be indicated for this stage? What is carcinoma in situ? Stage CIN2, about 2/3 of thickness with dysplastic or abnormal cells. Surgical procedure, conization procedure, for example, the large loop excision of the transformation zone, which is fertility sparing. Carcinoma in situ, pre-malignant state whereby the entire epithelium thickness is affected, but the basement membrane is still intact, CIN3. The following week, you head to the pathology tissue processing lab to look for signatures. You observe the following post-surgical specimen that had been resected from a patient. What procedure was performed? What stage of cervical cancer was this likely to be? Figo classification. Name structures labeled A to F. Procedure: pelvic exenteration. Stage of cervical cancer, stage 4. Involvement of the bladder and rectal mucosa. A. Urinary bladder. B. Urethra. C. Vagina. D. Cervical cancer. E. Rectum. F. Uterus. Bonus question. Type your answer in the comments. Cervical cancer is preventable. What viral infection, including subtype, is associated with cervical cancer? How can it be prevented? The stories, the statistics, the champions of cervical cancer in Kenya. Thank you. You got this.
XYZ, Z, XYZ, Z.